Today we're going to discuss what is the best type of kidney transplant. For those who tune for the first time, I am Dr. Francisco. I am a specialist nephrologist and a transplant immunologist working at Francisco Kidney and Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems or at risk of kidney problems or their relatives to be better informed about kidney disease, so they can take better control over their disease, minimizing worries, and to take better decisions with their own doctor or with me if they choose me to minimize complications. So what is the best type of kidney transplant? If I rephrase that question, is it the same if I receive or you receive a kidney transplant from a living donor than from a deceased donor? The short answer is no. Both are different. The outlook in terms of quantity and quality of life, plus the actual length of life of the transplant itself, is better in most patients undergoing a kidney transplant from a living donor than from those patients receiving a transplant from a deceased donor, someone that died and donated his or her organs. However, kidney transplantation is a very complex field. What I just mentioned is true for the average standard patient, but many patients with kidney disease differ greatly in their health and medical problems. But let's go into more details so you can understand better. There are different types of kidney transplants depending on the types of donors. And the outcomes greatly depend on these, as I just mentioned. If it is a living donor related transplantation or if it is a deceased donor related transplantation. No? Live donation occurs when people who are alive donate one of his or her kidneys to a loved one, a close one, or maybe someone that they don't know, but they do it ideally altruistically. Family members are commonly the living donors, and in many occasions the life partners. One of the reasons of this type of transplant provides, great benefits is because it gives good benefits to the transplant survival. One of the reasons is the fact that the degree of organ and genetic compatibility between the patient and the donor is greater when they are from the same family, like brothers and sisters, let's say. And if they are not from the same family, at least not related genetically, for example, like a spouse or someone more distant, doctors have the opportunity and the time to search for a better compatible donor. All this means that they have fewer chances for transplant rejection, which in turn means that they will need less doses of immunosuppressive drugs used to prevent the rejection of the transplant, and in turn lower chances for requiring the use of rescue medications against rejection if they were to suffer a rejection episode. These anti-rejection medications bring a lot of toxicity and side effects to patients, so it is ideal to minimize their doses and their need. Many doctors say that with modern immunosuppression, achieving the best possible immune compatibility is not that important. I don't fully agree with that. Yes, modern immunosuppression is powerful and can be tuned up to minimize risk of rejection or transplant loss. And many episodes of rejection can be indeed treated, but there is always some risk left behind. the immune system, after a rejection episode or after, being challenged for poor immune compatibility, sort of it is already primed with, the guards up to try to fight the transplant. And aiming for better compatibility will come with less need for higher dose immunosuppression and less chances of using salvage immunosuppression. And as a consequence, less accompanied toxicity. Remember, one of my premises of care, if you have been following all these months, is prevention being better than cure. And I do prefer to be preemptive over being reactive. Also, it's easy to prevent a problem than solve a problem. In living donation, also the quality of the donated kidney, that is the quality of the kidney tissue itself, is higher when compared to deceased kidneys, as it comes from a live person, a healthy family member, or a close person. This means that the kidney transplant has more chances to last for longer than kidneys from deceased donors. Also, after someone dies and donates his or her kidneys, those kidneys typically need to be left on ice or any sort of preservative solution or device for a good length of time, several hours, while finding a compatible donor, and usually that is done in a rush. Organs left on ice or in different preservation solutions or devices, they suffer a little bit of, let's call it, tissue decay. In addition, in living donation, in contrast to donation from deceased donors, the kidney transplant can be performed promptly without the need to remain in dialysis for years, in a waiting list for years, while waiting for a deceased donor. This is actually very important, as during those years on a waiting list and undergoing dialysis, many complications can occur. And many of them can lead to patients' loss of health and loss of fitness to undergo a major surgery like kidney transplantation in the future. All these benefits can be even greater if kidney transplantation is performed before undergoing dialysis, what it is called preemptive transplantation, or at least as soon as possible after starting dialysis, ideally within the first 6 months, which avoids the side effects of prolonging the kidney failure status and the side effects of the partially effective dialytic therapies, as they cannot clean the blood as well as a kidney transplant. So the body is continuously living for long periods of time in an environment with higher levels of toxins, even when they are undergoing dialysis, because as I mentioned, dialysis is not as efficient as normal kidneys or as efficient as a kidney transplant. Because dialysis only can clean the blood to the minimum level to keep definitely the patient alive and as free of symptoms as possible and as free as complications as possible. But still, with time, all toxins always on the little high side, with time, they have an effect on patients' health. Because yes, the blood is never cleaned to normal or even to close normal levels while undergoing dialysis. Furthermore, this is true because the kidney transplant is natural. It's a normal kidney. fully functional, providing not only the potential to clean the blood, but other functions that the kidneys normally do, like controlling water, electrolytes, the acidity of the blood, producing some hormones for bone health, anemia protection, etc., which no dialysis machine can do. Overall, the best potential option for replacement of kidney function is a kidney transplant. And the best potential type of kidney transplant for patients who can choose between all these options is a preemptive, remember, to be performed before undergoing dialysis, where the kidney organ comes for a living family or a partner, and ideally aged match. In those circumstances, kidney transplantation offers the best potential outcomes, leaving deceased donor transplantation and dialysis as second or third options, respectively. As commented in previous videos, not every patient is unfortunately suitable for kidney transplantation. Also, the kidney transplant surgery is bound to hard surgical and anesthetic risk, as any other major surgery. In addition, patients with kidney failure tend to have several coexisting illnesses, and some have many medical complications already. When doctors are worried about the risk for surgery being too high, they might advise patients against transplantation. For instance, patients having multiple or frequent complications or consequent disabilities, especially if elderly and frail. Likewise, patients with active or recent cancers or active or serious infections or having other medical contraindications might not be suitable for kidney transplantation. Thus, in some patients, dialysis might be safer than kidney transplantation, and in occasions is the only option. Therefore, all decisions must be individualized. In Francisco Kidney and Medical Center, we can assess you in more detail and address more specifically all your queries, as this is a difficult, important, and complicated decision. But with the right information and guidance, you can take the best possible decision for your future well-being. We provide empathetic, approachable, and flexible specialist renal and medical care because we can imagine the struggles our patients and their relatives could face in these difficult situations and these difficult decisions. So if you need our help, just contact us. I wonder if there is any question or comment. If there is none, at this moment, you can leave it later while watching the replay. If you find this useful, give me some thumbs up, some likes on the post. If you comment, it's useful because we can clarify some doubts and you can favor engagement from other people. If you think some of your peers undergoing the same struggles as you can benefit from knowing a little bit more about kidney disease and all these issues and options, you can invite them to form part of this Facebook group. Okay, if nothing else, I am Dr. Francisco, wishing you the best possible health. Take care. Bye-bye.